Well, as promised, we go over to Malawi, and Malawi has burnt nearly 20,000 expired COVID-19 shots despite assurances on shelf life. COVID-19 vaccines that expired 18 days after arriving, despite assurances from the African Union and World Health Organization that the vaccines were safe until mid-July. Now, a batch of 102,000 vaccines arrived on March the 26th under an initiative by the AU and the WHO, and they expired on April the 13th, leaving less than 3 weeks for them to be used. Malawi managed to deploy about 80% of them by that time. Now, joining us on Zoom, Fatsani Gunya is a journalist with the Nation newspaper from Blantyre in Malawi. Fatsani, thank you for joining the conversation. Just checking whether you can actually hear me.
Loud and clear.
Loud and clear. Now, Malawi has become the very first country to actually do this, and there has been some caution from the WHO not to actually, do this as far as these vaccines are concerned, to dispose of them in this manner. We've seen some countries that have actually got them into their systems for use. Why this drastic action, let me say? Why?
I think, okay, allow me, simply because I'm alone, I think I need to remove my mask first. All right, basically the situation about the COVID-19 issue, especially when we talk about this vaccine issue in Malawi, it has generated a lot of interest, I mean, both from within and from the international community. You are right, the WHO and several other health organizations were not in agreement to the government's decision to actually destroy the expired vaccines. The issue has been, but government, you need to understand that government has been pushed to do this because people have been kind of, it's an issue of trust from the beginning. People have not been trusting enough to the government. They have been skeptical since the whole COVID issue started, like in March last year. And when the vaccine was first announced that it was coming, it found an already skeptical population. Now, they have got some myths that have been going around about the vaccine itself. And now with reports coming out from the health ministry to say that the vaccine is actually going to get expired within some weeks, it kind of pushed the uptake of the vaccine down. So people were already skeptical, like I've always said. So it was difficult for the government to move on to say, okay, despite the reassurances from the WHO that it could still be used, they decided to go on and destroy, because they are trying to win the public trust to say, okay, this time around we destroyed the expired drugs, and if another batch comes in, it will be new, so that a lot of people can always come. You may also wish to understand that Malawi kind of organized to have 11 million of its 18 million population to be vaccinated. But you'll find that up to date, I'm talking of about 336,000 to 826 only as of yesterday, because we are still waiting for the data for today. But as of yesterday, only about 336,826 got vaccinated, of course, including me because of the nature of my job.
Well, congratulations on getting the vaccine. I also got my jab yesterday. So, but taking a quick look at the case count, what is the picture basically in Malawi currently? What is the current status?
Since it began in March, like I said last year, by now we have about about 34,238 people got infected, and out of this we had 1,153 deaths to date. Like I said, until yesterday, we are still waiting for today's data from the ministry. And like I said, the vaccinated today is about 336,826 to be exact. And those that have been that have recovered to date, we are talking of 32,246. And active cases, we have kind of scaled down to 705. And out of these, we have got only 5 patients the country over that are in the isolation wards. Only 5 patients out of the many hospitals that we have. So only 5 patients. So when it comes to the vaccine, we are using, or we subscribe to the AstraZeneca or the Oxford vaccine, and the total vaccinated to date, it's 40,104. And out of the deaths, I think it has to be highlighted, out of the deaths, it included 2 cabinet ministers who died within a space of hours of each other. So I think that kind of pushed a lot of people to go to start getting vaccinated, because it kind of, oh, this virus is real and it's going to kill, it's here to stay.
Okay, so right before you actually take leave of us, I know you've spoken about skepticism and why the government of Malawi had to take this drastic measure just to win public confidence. But when it comes to stereotyping, which has become a major issue, how has Malawi dealt with that issue?
You can't rule that out. I mean, Malawi is in Africa, and you know what this means in Africa. A lot of people, I mean, including even in our families, there has been that stereotyping so much that, I mean, you don't have to go there, you don't have to get a job. So there are some individual decisions that have to be made, and there are other institutional decisions that have to be made. But by the end of the day, I think people are going to always weigh, okay, which one is good for me and which one is good for my family and the like. So I know eventually people are going to come in, but like I said, I think they the second wave that kind of hit our country late December and early January this year, and the caliber of people, high profile people that succumbed to COVID-19 kind of pushed the urge in people to say, okay, let's go and get a job. You never know, we should get protected from the virus. So it kind of, you can't rule out the stereotyping. It's still there. You know, there are a lot of myths. We are a religious country. A lot of people, we have seen government pleading even with the faith sector to say, okay, can you convince your people to come forward? So I think that campaign kind of helped, but it's not enough, because you look at the figures. If they targeted about 11 million, and we have only vaccinated about 336,000. It's still a long way to go, so to speak.
Fatani, thank you very much for engaging us all the way from Malawi. Fatani Gunya is a journalist with the Nation newspaper, and he was engaging us on the destruction of some 20,000 vaccines in Malawi.